You're sitting in the doctor's office, staring at a printout of your blood work. Liver enzymes elevated. And the diagnosis, fatty liver. No symptoms, no warning. Just a quiet problem hiding in plain sight. Here's what most people don't realize. Fatty liver disease now affects nearly 1 in 3 adults. That's not a rare condition. That's an epidemic hiding behind routine blood tests. For years, doctors had no targeted treatment, just advice to lose weight and hope for the best. But a March 2026 study may have changed everything, with something as simple as vitamin B3. Now, before you rush to the supplement aisle, and I know some of you are already thinking about it, there's more to this story. The research is promising, but the caveats matter. What the researchers found isn't just about a vitamin. It's about uncovering the genetic machinery that makes livers accumulate fat in the first place, and how to shut it down. Today we're going to trace exactly how they did it, the molecule they identified, the screening process, and why a cheap B vitamin came out on top. First, let's talk about what fatty liver actually is. MASLD, Metabolic dysfunction-associated steatotic liver disease, used to be called NAFLD. The name changed, but the problem stayed the same. Your liver is supposed to process fat, break it down, send it where it needs to go. But in MASLD, fat accumulates inside liver cells. They get bloated, inflamed, and over time, scarred. The scary part? Most people have no idea. Early-stage fatty liver doesn't hurt, it doesn't announce itself. You can walk around for years with liver cells slowly filling with fat and never feel a thing. By the time symptoms appear, fatigue, abdominal pain, jaundice, the disease has often progressed to something more serious. Fibrosis, cirrhosis, even liver failure. The numbers are staggering. MASLD affects approximately 30 to 40% of the general adult population globally. That's nearly 2 billion people worldwide living with fatty liver. And it gets worse for certain groups. Among people with type 2 diabetes, the prevalence jumps to 60 to 70%. For those with obesity, it's 70 to 80%. Here's what keeps hepatologists up at night. By 2040, more than 55% of adults are projected to have MASLD. That's a majority of the adult population. For decades, the standard advice was simple. Lose weight, exercise more, eat better. And that works. A 5 to 10% weight loss can significantly improve fatty liver outcomes. But lifestyle changes are hard. They require sustained effort over months and years. And for many people with advanced disease, diet and exercise alone aren't enough. Recently, the FDA-approved treatments like resmetirom and subcutaneous semaglutide for advanced cases. But these are expensive, targeted at late-stage disease. No drug went after the root genetic cause. Until this year. In March 2026, an international research team published findings that could rewrite how we think about fatty liver treatment. They found the switch that turns the disease on, and a way to flip it off. The key player they identified is something called miR-93. MicroRNAs are tiny molecules that regulate gene expression. They're like dimmer switches for your DNA. miR-93 specifically targets a gene called SIRT1. When miR-93 levels are high, SIRT1 gets suppressed. And SIRT1 is crucial. It's responsible for healthy lipid metabolism in your liver cells. Here's how it works. When miR-93 levels climb, it blocks SIRT1's ability to function. Fat builds up in liver cells. Inflammation follows. Then fibrosis, scar tissue, replacing healthy liver. The researchers realized something important. If elevated miR-93 drives the disease, then lowering miR-93 might reverse it. They just needed to find what could do that. So they did something ambitious. They screened 150 FDA-approved drugs to see which ones could lower miR-93 levels. Drugs already proven safe in humans. Out of all those drugs, everything from heart medications to diabetes treatments, one compound stood out. Niacin, plain old vitamin B3. It was the most effective at reducing miR-93 levels. Niacin isn't exotic. It's not a new drug costing thousands of dollars a month. It's a B vitamin your body needs anyway, found in meat, fish, whole grains, legumes. Supplements cost pennies per dose. When the researchers gave niacin to mice with fatty liver disease, the results were dramatic. miR-93 levels dropped sharply. SIRT1 activity increased. Normal fat processing pathways came back online. The livers of treated mice showed reduced fat accumulation, less inflammation, and decreased fibrosis compared to untreated controls. The vitamin was doing what expensive pharmaceuticals aim to do. Now I can hear what you're thinking. If vitamin B3 works this well, why isn't everyone taking it? And that's where we need to pump the brakes a little bit. The researchers themselves are clear about this. Quote, "The current results are based on animal experiments and clinical trials in humans will be necessary. Mice aren't people. What works in a rodent model doesn't always translate." This is really important. Don't start megadosing niacin supplements based on this research. High-dose niacin can actually cause liver problems, which is darkly ironic given what we're discussing. Niacin supplementation can also cause flushing, that uncomfortable warmth and redness people sometimes experience, and it may interact with blood pressure medications and other drugs. The right approach here is patience. Human clinical trials will determine the optimal dose, the best form of niacin to use, and which patients might benefit most. But here's why this research matters even now. Before human trials are complete, it identifies a specific target. For the first time, we know that miR-93 is a key driver, and that it can be suppressed. That opens doors. Other researchers can now study this pathway. Pharmaceutical companies might develop more targeted drugs, or different forms of B3 supplementation might emerge, ones designed specifically for liver health. In the meantime, the American Gastroenterological Association updated their MASLD care pathway in March 2026. Lifestyle interventions remain the foundation: diet, exercise, weight management. The American Diabetes Association Consensus Report puts it directly: lifestyle interventions including weight loss, physical activity, and dietary changes remain the foundation of treatment. So what should you actually do with this information? If you have risk factors for MASLD, obesity, type 2 diabetes, metabolic syndrome, consider asking your doctor about screening. Many people have fatty liver and don't know it. A simple blood test can check liver enzymes, and imaging like ultrasound can show fat accumulation. Early detection means earlier intervention. If you're diagnosed with MASLD, the evidence strongly supports weight management. Even a modest 5 to 10% reduction in body weight may significantly improve liver fat and inflammation. Don't self-prescribe high-dose niacin based on this mouse study. The research is promising, but human trials will tell us the safe and effective dose, if there is one. What you can do is ensure adequate dietary intake of B vitamins through whole foods, whole grains, legumes, lean proteins like chicken and fish. These naturally contain niacin your body needs. That's different from megadosing supplements, which can have unintended consequences. Getting nutrients from food provides balance. Your body knows what to do with food-sourced vitamins. The bigger picture here is fascinating. MicroRNAs are emerging as key players in many diseases, not just fatty liver. Understanding how to modulate them opens new therapeutic territory. This study shows something elegant. A cheap, common vitamin can influence gene expression in ways that matter for disease. That's not nothing. That's a proof of concept that could reshape therapeutic development. If this topic interests you, if you want to understand the science of liver health and stay updated on developments like these, consider following along with us. We cover stories like this regularly, breaking down the research so it actually makes sense. And here's the thing about fatty liver that doesn't get enough attention. It's not just a liver problem. MASLD is intimately connected to heart disease, diabetes, and metabolic health broadly. People with MASLD have significantly higher rates of cardiovascular disease. The liver talks to the heart, metabolically speaking. Treating one may help the other. That's why understanding MASLD matters even if you think you're healthy. Your liver does 500 different jobs. When it's compromised by fat accumulation, ripple effects spread throughout your body. The researchers who identified the miR-93 pathway are continuing their work. Future studies will test niacin in human liver tissue, then eventually in clinical trials with actual patients. That process takes time. Years, typically. Regulatory approval requires evidence of safety and efficacy in humans, not just promising rodent data, but the wheels are in motion. In the meantime, focus on what we know works. If you're concerned about liver health, the evidence-based path remains clear. Maintain a healthy weight, stay physically active, and eat a balanced diet rich in whole foods. Talk to your doctor about screening if you have risk factors. Ask about your liver enzymes. Discuss whether imaging makes sense. Early detection opens doors to intervention that works. And keep an eye on this research. The niacin-miR-93 connection is just the beginning. Scientists are now looking at other compounds that might influence this pathway, potentially with fewer side effects. The study was published in the journal Metabolism and covered widely in scientific media in March 2026. This isn't fringe science, it's mainstream research from credible institutions. The lead researchers, Choi, Yun, and Park, are explicit about their caution. They know what they found is promising. They also know the distance between mouse model and human medicine. So where does this leave us? With hope. Cautious hope. A 30-cent vitamin might one day treat a disease affecting billions. But we're not there yet. What we have is a target, miR-93, a tool, niacin, and a pathway forward that didn't exist a year ago. That's real progress, even if the headlines oversimplify it. This content is for informational purposes only and isn't a substitute for professional medical advice. Always consult your doctor before making changes to your health routine. If you found this useful, we'll keep following this research as it develops. Until then, take care of your liver. It's doing 500 jobs without asking for credit. The least we can do is pay attention.